To all of the Diabetes Path Workshop leaders, your work is truly allowing Michigan residents to live well with diabetes. Today, I would like to talk about a big part of the Michigan Diabetes Path process, data collection. The data collection process begins after the leader has registered the workshop. A leader may register a Diabetes Path workshop at the address on the screen. Once registered, and before the workshop session 1, you must download, print, and fill out the data collection forms. These forms are available here. The first form is an attendance form. The form is meant to record participant attendance for all 6 sessions. After filling out the course information at the top, write the participants' first names or nicknames in the name section. Each line has a participant ID number assigned to the name written on that line. This number is important as you will use it on the participant information form pre- and post-tests. Once you have recorded everyone's name, make sure to hold on to this form, recording everyone's attendance for all 6 sessions. After session 6, this form will be mailed back to the state. The next form is the welcome letter. This form is to be given to attendees and read aloud by leaders at the beginning of session 1. There is nothing for participants or leaders to fill out. After reading the welcome letter, the participants must complete the participant information form. This is a form where the attendee identifies certain demographic aspects about themselves, including, but not limited to, health conditions, race, and gender. The workshop leader must fill out the appropriate participant ID numbers and date. The next form is the Diabetes Path Survey. This is the pre-workshop survey to gauge the participants' current knowledge of diabetes self-management. This survey will also be given to attendees at the end of session 6 to see how much they have advanced and how effective the Diabetes Path program has been for them. This will also require leaders to fill out course, location, and participant ID numbers, as well as the type of survey it is, pre or post, and the start date of the workshop. After completing the pre-survey, you will hand out the contact information and consent form. This form contains data entry fields like name, address, email, and phone. This document will also require the leader to fill out course ID, location ID, and participant ID numbers. After completing the first session, it is time to fill out the cover sheet. This cover sheet quickly identifies where the workshop forms were gathered and how many participants are in the class. Now that you have your forms filled out, it is time to mail them to the Michigan Department of Health and Human Services. You must do this within 24 hours after the conclusion of session 1. You must include the consent form, the diabetes pre-survey, participant information form, and cover sheet. Save the attendance form as you will track attendance on this and send it in at a later date. If you gain new attendees on session 2, follow the same steps to collect information and mail the forms back within 24 hours. Or, if you have a secure place to store the forms, mail them with the session 6 forms. Make sure all bubbles are completely filled in before sending out for proper data collection. Now that you have completed 5 sessions of the Diabetes Path Workshop, the next part of the data collection process begins with the evaluation form. This form is meant to record participants' feedback regarding the workshop experience. Like many of the other forms, the leader must complete the course ID, location ID, and participant ID numbers. Next is the post survey. This is exactly the same as the pre-survey, but the leader must remember to fill in the post-test bubble to denote when this survey is being taken. The post-survey is important to complete to measure how participants have improved their self-management skills. The leader must remember to assign the correct participant ID to the post-survey that matches the other forms the participants filled out. If you know a participant is unable to attend session 6, you can have them fill out their form after session 5. The workshop summary form is the last form to be filled out. This, like the cover sheet, identifies the workshop where the evaluation forms were collected and the number of participants that completed the workshop. After all of these forms have been filled out, you must mail the entire packet to Michigan Department of Health and Human Services within 72 hours of the completion of the 6th session. Feeling overwhelmed by this process? A checklist is also available to make sure you do not forget any of the steps in this process. You can find this checklist, as well as all of the other diabetes path forms, at the address on the screen. With the correct completion of the data process, the Diabetes Path Program can analyze feedback to help identify successes and improve areas of weakness. Once again, thank you for your time and commitment. With your help, we can enable those with diabetes to become better self-managers.